So our program is Emergency Preparedness and Response, and we are focused on the public health response to disasters. So we look at any human impact that is caused by disaster, and if you think about any disaster, there's always a human impact.
You never know what's going to come next. Usually our plans are built around all hazards, so we can use what's built in our plans to respond, whether it's to a fire or a flood or a pandemic.
So rather than looking at just one scenario, we now look at sort of the unknown scenario and how we're going to be able to plan and respond to that.
That gives us the ability to be more adaptable and flexible for what comes up and adapt the plans towards that. So it's looking at more of processes. How are we planning to communicate between ourselves and with our partners? How would we access resources?
The response to public health events and wildfires and community preparedness and recovery are fed through 15 capabilities. And so we look at public information and warning, we look at our response to activating our emergency management structure, so how fast can we do that? And we have a 60-minute time frame that we aim to do that for.
When an event happens, such as a fire or flood, that's when we're called into the EOC to support in those elements as we can to support the event there.
With wildfires, we'll focus on messaging related to air quality. We work with our local hospitals to do some syndromic surveillance around are they seeing populations coming in that may be impacted by the smoke. We also go in after a disaster in a recovery mode and help the residents that have been affected by the disaster look at their wells and septic systems and what to do if the power has been out in their house for a long time, making sure that they have proper food safety procedures in place within their homes.
We have different training and exercises throughout the year, focusing with our public health incident management team, where we train them on certain activities or responses, and then we practice those with drilling, tabletop exercises and discussions, as well as doing a full-scale or functional exercise where we actually walk through the process and the plan.
One event that will take a lot of time and resources and have the greatest impact is a pandemic event. It will have great effect on the behavioral health of the population. There will be mass fatalities that will unfortunately occur. It will take a lot of time and resources from the health department and our response partners to be able to handle an event of that scope.